We've talked so far about our patients' position themselves and how we can reduce their ability to be mobile and generate force. But now we're going to talk about our positioning relative to the patient. What we want to try and avoid is being directly in front of our patient. If Corey's turned and faced me, so if we just do this from a standing position, I have all the weapons to deal with potentially. And by weapons, I'm talking about limbs. Corey has the ability to reach me with his left, with his right, and the same with both legs. This is bad. Also the head's right here. He's able to see me very effectively, and his muscles are aligned so that he's able to perform strong compound movements. If Corey puts his hands on my shoulders, he creates a strong bench press, even if he just curls his arms in a bit here and shoves me right now, it's gonna be very difficult. If it's arms versus arms, I have no advantage right now because he's got the exact same positioning that I do. What we wanna try and do is create a positioning off to the side of the patient or its client. I'm so used to saying opponent in these jiu-jitsu videos that I'm trying to not use that word because it doesn't sound very healthcare. So being off to the side of Corey, if we look at the extreme example now, Corey right now can hit me with his left arm. He could hit me with his left leg. But if you don't move Corey, can you hit me with your right arm?
Not really.
No, can't hit me really with his right leg either. That's the main advantage of this, is that it takes away one side of his body that I have to deal with. So Corey, could you have a seat for me, please? By me approaching him and working from him from here, which is typically for most of your healthcare duties, like this is gonna be pretty natural anyway. You're usually beside somebody so that you can work with a single arm, work with a single leg, be able to perform examinations, whatever. When I get in front of Corey, like this, doesn't matter if I'm in proper base, Corey has the ability to still like access my groin, hit me in softer areas, hit me right in the face, and I gotta deal with both sides. If I was here and I'm working with Corey, by me being off at a 45-degree angle, it's quite natural still to be able to have a bit of a conversation, and I've minimized. Obviously, if Corey leans forward, twists his body and reach me with that side, he still can, but it's minimizing. That's all we're trying to do is just reduce the chance of significant injury here. The other thing that this does is it aligns my body to have those same strong compound movements, like a bench press, against the weaker muscles of Corey. If Corey was to push his arm straight out right now, push straight out that way, I know it just sounds stupid, that's not at me, that's fine. But if Corey was from here, if he twists from here, he's gonna break his posture a bit, so that might make him weaker, but especially what's more common is something like, if I'm holding him and he tries to backhand me right now, what's happening? His movement right now is like a reverse fly with his shoulder versus me and my tricep, my lat, my shoulder. And so Corey, resist me right now. Don't let me push your arm in. It's quite easy for me to be able to do that. Obviously, if it's a 300-pound man and you're a 100-pound woman, that might still not be enough, but all we're looking to do every time is put more of the cards stacked in our favor. By me being here, I can't even balance. Corey tries to backhand in any kind of way and hit me. I have strong alignment and positioning relative to him to use strong pushes to be able to resist. Not trying to knock our patient over, but it depends on the circumstances. Maybe that is unfortunately a situation where you're like, man, this guy is way too big, way too strong, a younger guy, and I need to shove him over into the bed. Hopefully he's just falling into the bed and not off the bed, but shoving him over so that you have even more time to try and get out of that situation. Positioning yourself is so important. Being behind is obviously the most strategic advantage position that you can have on the client that you're working with, but it's not natural. It makes the person feel uncomfortable. Maybe you have to have them sitting on the bed so that then you're able to go back to the dresser and it's for like a small window of time, which can actually be good too, because you should never turn your back as well. So as we talk about our positioning relative to our client, I obviously can't let my client or patient get that same positioning on me. If I'm working with Corey and I stand in front of him like this and I turn to grab something, I've put him to the side of me. And by him being to the side of me, I now have less tools to be able to work with him, but also to defend myself, and he's got everything stacked in his favor to be able to hurt me. If I turn my back, so if I'm working with like a client at their home and I have to turn to grab something off of a shelf, I wanna be very aware of the distance between me and him and where he's at the totality of the situation before I turn my back. Because if I turn my back like this to Corey, I don't know what could happen. And so knowing that Corey's sitting down, knowing that, say like Corey said at the very end facing out towards the stairs, if he was sitting here, and this is where I had my positioning, and then I have to grab something from over there, I'm more comfortable turning my back to Corey for a small window because I know his back's also to me. And I know that he's seated. And I know that now if he starts to move, I can hear it. Hopefully I can even keep a look out of the corner of my eye. So I'm always trying to keep him in a line of sight so that I can hear him move, I can see movement, I turn back to face him. Because if I have my back turned, it's gonna be a bad time. So sometimes you'll be directly behind your patient, but most of the time we're just looking to be off to the side. We want to try and establish that as early as possible. Once again, through the work environment that you're in, this is actually quite easy to do just because people are used to this. But also try and find natural reasons to step off the line like this. So as Corey's sitting down, naturally by him sitting, he's inclined to just stay in one place and it should be easier for me to approach. If he's already sitting here and I walk up to him, it could feel a little bit weird in the situation if I step up and I do this, and then I start talking to him. All of a sudden I did some big unnatural motion that just looked a little bit clunky. There was a nurse that I worked with at the Nanaimo Hospital that she was quite creative, where she knew about creating that dominant angle to the client that she was working with. And she would have something like a cup of water, like just a plastic cup with some water, so it's not potentially a weapon, or a cloth that she would use to just wipe things down with. And it was basically like a prop that she wasn't even necessarily gonna be using in that patient interaction, but she had something that she could naturally just walk up and be like, hey Corey, how are you doing today? Step off to the side, put the item down, turn to face, and already have this 45-degree angle established on the client. And she had a natural reason to do so. The client did not think that there was anything off by her stepping off the line, putting something down, because that's what she had to do, and then she turned, and she kept the conversation and the interaction very natural without raising any red flags. So it can be very easy to create that positioning, but 45-degree angle to your client or directly beside your client to minimize the one side of their body as risky tools that they could use against you, and also to be able to align yourself to use strong compound movements against their weaker movements.